I have an aneurysm. It's a 6.2 centimeter instead of 3.2, something like that. So he told me that this is a dangerous situation and we have to operate.
We started to ask, where should we do it? I had no option in doing it in Egypt because it's not very often done there, and I wanted to make sure we make it in a place where they make it very often and to have good results.
I asked them to obtain some further testing because I knew it would be quite expensive for them in the United States. And I was able to assess them, and we had a complete workup by the time they arrived.
We have a small family. We are both pharmacists. We have two boys, George and Michael, and they are both pharmacists. We flew all the way from Egypt, Cairo, till here to come to the Cardiovascular Center here in Michigan.
The University of Michigan gives me a complete team for comprehensive care. We have had expertise in this area since the late 90s. I believe that the university goes out of their way to recruit the brightest and the best on every level. They plant the seed for a collaborative type of environment where everyone works together to bring everyone up to become the best that they can be.
I think the team worked like an orchestra. Everyone in the team knew what to do, when to do it, and how to do it. Actually, they all worked together to get out the most beautiful symphony you can ever hear. In my point of view, it's like the symphony of life.
His main problem was a ascending aortic aneurysm, which was about 6.5 centimeters. It went up into the arch, and it presented the patient with quite a prohibitive problems. I sort of tell patients and families to think of the aorta as the interstate highway, and you're in New York City, and you're riding the highway at high speed. If there's a problem or an incident, it's going to be a major problem and incident because there are many more cars traveling at a very high speed. And it's the same thing with the thoracic aorta, especially the ascending aorta, where he had his problem. It was just above the heart. So that when the heart pumps out the blood, it pumps it out at the highest velocity, and you have the maximum amount of blood. So this is an area that's very dangerous to have a problem. And so as the aorta gets bigger, it carries more blood, it travels at a higher velocity, and the aorta becomes more tenuous because it dilates and it thins. And so he was at a significant risk for a catastrophic event. And because of the association of the position of this aneurysm with the heart, there's a valve called the aortic valve. So this valve was beyond repair and needed to be replaced. But in addition to that, we found a little surprise that his tricuspid valve was leaking very badly.
And he had to put a ring around it to make it close properly. So actually we had 3 operations in one. All the time we stayed in hospital after making an open heart surgery for 9 hours. It was just 4 nights. 1 night in the ICU and 3 nights in an ordinary room.
Places that perform particular procedures in a high volume and a high quality level have the best results. Because we've been doing this for a very long time, and we do it every day, aortic work here has been an everyday phenomena. We're able to accomplish this quite efficiently and quite effectively.
I would advise any person who can come having a heart problem, this is the best place you can come to. We're going back home together.